Hello, everyone. I am Dr. Tahir. Welcome back to Youthful Medicine. Um, I am a rheumatologist and I see patients who have immune compromised conditions. And one of the problems that I see is a infection by herpes zoster infection, which in non-medical term is called shingles or herpetic zoster infection. So I'm going to talk a little bit about that infection. So today I saw a case of a 65 years old male with history of hypertension who has been under some stress because of some issues going on at his home, and they were involved in some hurricane situation lately, and this patient had presented to me with a rash that was covering his left chest front and the back of the left chest wall and the back. So he wasn't sure what it is. These lesions appear red, blisters type of lesions, vesicles, and they were painful and itchy, and they started about 24 to 48 hours ago. So I would like to explain what is herpes zoster. Herpes zoster or shingles is a viral infection. It is caused by Varicella-zoster virus, the same virus that causes chickenpox. After someone recovers from chickenpox, this virus remains inactive in our nervous tissue near the spinal cord in the brain. And the brain, so it's sitting there waiting for it to reappear. Years or even decades later, the virus can reactivate, leading to shingles, and usually it could be a moment of stress in someone's life. While anyone can get this infection or shingles, it's more common in older adults, people with immune compromised conditions, patients above the age of 60 years of age. The immune system weakens with age, which increases the risk of the virus reactivation. And people who have multiple medical conditions, they can have it. So, what are the symptoms of herpes zoster? Let's talk about the symptoms that you should look out for. Number one, usually it is the one side of the body. It comes as a horizontal infection and usually begins with pain, burning, or tingling. In this area, it goes along the dermatomes of our neuronal roots. So it's usually spreads like this, but if it is in your arm, it could be in a line. So there, if you ever look up dermatomes on a Google search, you will see how they appear, and that's what these vesicles, they follow that direction. This is followed by, so the first symptoms are pain and tingling and burning that you will feel. And this is followed by red rash that evolves into clusters of fluid-filled vesicles or blisters. This rash usually appears on one side of the body, as I said, and often on the trunk. It can be on the face, it can be near the eye, which can be very dangerous. So don't delay the treatment, and it can persist for about 2 to 4 weeks. Other symptoms that may come with it are headache, fever, upset stomach, but the pain is most significantly a prominent symptom and disturbing symptoms. My family member last year had one, and it was quite distressing for them. And I've seen many patients who have this, and so I try to get the information out there so that you don't delay the treatment if you see someone having this. So the virus is affecting the nerves, and that's why you feel an intense amount of burning pain. This uh, pain could persist for weeks, months, and years even after the rash is healed if you did not get treated on time. This condition that the pain persists is called postherpetic neuralgia, and it can impair the quality of life of the patient. The causes and the risk factors for this infection are, as I said, immune compromised conditions, age more than 50, weakness of immune system through medications like steroids, previous illness, physical or emotional distress, and medications, as I said, chemotherapy also can do it. So in our case today, a 65 years old male who had a typical age for shingles was under mental and physical distress because of dealing with the hurricane. developed this rash, and within 1 or 2 days he noticed it and he came to treatment. So the treatment options that we discuss, early intervention is really important. Sooner you treat, the better it is. And I started him with an antiviral treatment. The antiviral treatment for this case, I prefer valacyclovir, 1 gram 3 times a day, and it can help reduce the severity of the disease and also the spread of the disease, and also it can improve the lesions heal much quicker. You can also use topical acyclovir, which is a cream that you apply 4 or 5 days, 4 or 5 times a day for about 4 or 5 days. It can take about 72 hours for you to fully feel the symptoms are getting better. Pain management, ibuprofen or Tylenol, I've used it. Sometimes I even use medications which are stronger called gabapentin or pregabalin. And sometimes I also tell patients to use this topical lidocaine patch called Lidoderm. Lidoderm is one of the approved indications by FDA is postherpetic neuralgia for the pain. But one thing that I want to tell you is that prevention is important. Most of my patients, I tell them to get preventive vaccination for shingles. Shingle vaccine comes in Shingrix, which is highly recommended for older adults 50 and above to prevent herpes zoster. So precautions, when you are dealing with this infection, make sure that you avoid contact with pregnant women, newborns, or individuals with immune compromised conditions or medications. Immune disease patients or patients who have cancer, you have to stay away from them because they will get it and it can be very severe in them. Keep the rash covered to prevent the virus from spreading. Practice good hand hygiene. Start the medication quickly enough. And if possible, get the vaccination so that you don't even get the infection. So if someone you know who is experiencing these symptoms or have had these symptoms or they appear, please get help as soon as possible and take measures to protect yourself from this infection. Herpes zoster is a painful condition. You can get a prolonged case of chronic pain from it, so treating it early is important. If you have chronic pain, you can talk to your doctor about some treatment options, but if you're above 50, please make sure you get vaccinated. And at the end, I would request, if you found this useful, please like this video, subscribe to my channel so that I can continue to produce this helpful and reliable information for you and for your loved ones. Until next time, take care of yourselves.